Hi, everyone. I'm Claire Webster, Certified Alzheimer Care Consultant and founder of the McGill University Dementia Education Program, which was established thanks to numerous donations from generous individuals. Like many of you, I learned the challenges of Alzheimer's disease firsthand by caring for my late mother, whose condition deteriorated over a very long period of time. I truly believe that the key to navigating this disease is through education, by learning as much as possible about the disease so that you are always one step ahead and equipped to face the challenges that are ahead. Unfortunately, these words of wisdom did not come into play during my own journey, and I ended up suffering a severe nervous breakdown, which not only had a significant impact on my health, but it also had a ripple effect on my family, a reality that so many caregivers are facing. As a result of my own journey, I wanted to change the healthcare system. And in 2017, I knocked on the door of McGill University, just an ordinary citizen. I had the great fortune back then to partner with a team of healthcare professionals at the Steinberg Center for Simulation and Interactive Learning. Today, I work in collaboration with the Faculty of Medicine and Division of Geriatric Medicine in order to develop workshops to support family caregivers. This initiative is led by myself and my two wonderful colleagues, Dr. José Moret and Dr. Serge Gauthier. Our goal is to provide you with the tools and knowledge to help you care for your loved ones, and most importantly, to help take care of your own well-being. Since we are unable to offer these workshops in person during this period of social isolation, we have decided to develop these weekly webcasts to support family caregivers on a variety of topics. In order to kick off our first webcast, I wanted to begin by interviewing a caregiver who understands the journey of caring for a loved one who has dementia and who also recently lost her mother to COVID in a long-term care facility. I would like to introduce you to my friend, Isabelle Poirier, who was a caregiver for close to 9 years while balancing her life as a mother to 3 school-age children and a wife with numerous commitments in the community. Isabelle, thank you for being here today.
It's my pleasure.
First and foremost, I'd like to, acknowledge the passing of your mother, Elvin, who I had the opportunity to know for a period of close to 3 years. And, my sincerest condolences to go out to you and as well as to all the families who have experienced this. How are you doing?
Oh, that's a big question. I'm doing better. Day by day, it's the only way to take this. And it's just with COVID, I was going through that journey, as you mentioned, for the past 9 years, but everything was precipitated with the COVID, who took my mom very fast at the beginning of the pandemic. So in a way, it's kind of funny to say, but I'm thankful for that she didn't have to suffer for that long under these conditions. So with the help and support of my family and my loved ones, even by Zoom, because we're all in confinement, it's going better, and like working with you and trying to see the way this tragedy in a way could help others. It's going to help my healing as well.
Well, I'm very, really grateful that you took the time to be with me today, and I'm really hoping that your story, which resonates so much with mine, will have an impact on so many others who are, whether or not they're beginning the journey or currently in the journey. And I really want, I'm hoping that with the questions that I'm going to ask you today, it's going to really paint the picture of what family members are going through from the beginning of the diagnosis until the very end. So, in order to begin, I'd really like to know, when your mother was first diagnosed with Alzheimer's disease, or even before the diagnosis, what were the signs and symptoms that, first made you think there's something like off with my mom?
It's bizarre because for me it happened very quickly. I had the great chance of having my mom as a caregiver to my own children. As you mentioned, I have 3 children, and I had 3 children under 4 years. And for most part of it, I was working, and my mom was my support. My mom was our caregiver, and as my husband would say, she was our secret weapon. So I think for 5 years, like, I'd seen her every day of our lives. She was very present and very instrumental to raising my kids and helping me and my husband. And during that period, she turned 70 years old. And to thank her and to celebrate her 70th, we sent her to Vegas with some of her sisters. She comes from a family of 11 kids. and they went to Vegas to see Céline Dion and Cirque du Soleil,
Oh,
big, festivities. And she called me from there, and it was a shock, Claire. From the phone calls, I knew right away.
like what was she saying? Like
She
what?
was so like disoriented. I guess she was so much in her routine before. That was the first time also that I had not seen her for an extended period of time, that when she came back, she didn't really know where she had been. She didn't know what time, like she didn't know what period. It was a revelation. So upon her return, I brought her immediately to see a doctor.
So was she would because so I want to go back because what's interesting is, a lot of people think that dementia has to do with memory loss, and my mom, because you said 70, my mother at the same time, or around the age of 70, my dad had passed away the year before, and my mother just started behaving bizarrely. It was what she was saying. Like, there were no memory issues. It was just a complete change in personality. Like, would you say that's what happened to your mother? Was there a...
But in retrospect, even the
Yeah.
doctor said she was diagnosed very early. He said typically with that early like dementia, it could have been up to 3 years later that like bigger signs would have came. But I think they were even there earlier. And for us, it was like little, like more scratches on cars or like an erratic behavior. My mom used to be like an organizer, and now she had became kind of a hoarder, and she would get lost, and that's it. I would say erratic behavior.
Okay.
More than just memory. Like for sure, your loss of keys or a phone or everything. But she got lost like in the city. She got many scratches.
I like how you say the hoarding. I remember after my father passed away, and I would go to my parents' apartment, and I started going through the kitchen looking for something, and I'd find like hundreds of containers of blueberry and strawberry containers, and like, why are you collecting all these empty plastic containers everywhere? Like I only realized afterwards that hoarding was also one of the signs, right?
My mom
So
she discovered the Dolorama, and it was a big thing for her. So we got a lot of hoarding with different. She liked the play deck cards, like they were by the hundreds, and pans, pots and pans. She's not even cooking anymore, buying and like things from Bureau en Gros, like pans and like all kinds of stuff. And we discovered, like, I don't know, I think she was planning to open a store in a later life.
Now, oftentimes what I hear also from families, like in my own case, I mean, people don't necessarily recognize there's anything wrong with them. And so when a family member wants to bring them to the doctor, they're very resistant. Did your mother, like, did she feel different? And that's the first question. Number two, when you suggested you wanted to bring her to the doctor, was she in agreement to go with you?
The thing with my mom is from beginning to end, she's always been in denial. She never once admitted that she's suffered from dementia or Alzheimer. And I have to say that I used to have to deal with white lies and false pretense, and she was trusting me like dearly. So whatever basically I thought would be good for her to do, she would follow me. And so that was good this way, because she's had cancer and she's had other things in her like life before that would, like I said, you need to come for a checkup. But at the beginning, when they do the test on 30 points, so she's done that, and then more and more, like we went, and seeing her like fail that test was one of the things that was so heartbreaking, because
so how did they present the diagnosis to you? So you're sitting with her, and they bring out the test. So then what?
Then for me, it was, then you just won the lottery, the Alzheimer lottery, and good luck with that. Like basically good luck with that. Like nothing.
Were you given, and like what type of information were you provided? Were you provided like what type of information were you given by the doctor? Were you like, were you told here you need to get some information, you need to seek out support? Like, what were you given?
I wish, I'm sure I might be forgetting something because it's a long time ago, and it was very emotional. So maybe some things were said, but what I remember is like, I didn't leave with a little brochure or manual or something to say like steps to follow, what to expect, what should be done next, like call this person, find help, like nothing. Nothing.
what led me on my own journey, I remember it was September of 2006. And, and I often tell the story over and over again, but I mean, at first I didn't even know what type of doctor to bring my mother to see. And then, when the neurologist performed the MOCA, I didn't even know what that was. All of a sudden there's this paper that comes out and they're doing the test. And then next thing you know, she's being diagnosed with Alzheimer's disease. And the next thing is that I'm being asked the question if she drives, takes away her license on the spot. And the only prescription of care that I received was good luck, Mrs. Webster, right?
Same.
Right?
Good luck.
There was nothing, right?
Yeah. And us, it's funny because you're mentioning the driver's license. My mom she loved driving, and actually she was driving my kids everywhere, and we couldn't at early stage take her license. I think that would have killed her, and it was really early stage, so it was still like I guess a calculated risk, but we couldn't live with that with the doctor, so they flagged her to the Société de l'Assurance Automobile du Québec. So, and she knew, because she said she went for a test and she came back with her license. She said they think I have Alzheimer. Well, here you go, presenting her driver's license. And after, like, naturally, I think she denied it and she never admitted it. I think she knew, and she said, "Oh, I'm not really into driving anymore."
Okay, but
she naturally,
It's for a lot of families, it's so difficult to remove the license.
Yes, it's a big part of the independence, right?
So now she's given the diagnosis, and it was obviously becoming clear that she could no longer live on her own, correct? Like, was that becoming clear, right?
Yeah.
And in terms of, let's say, family members, there's you and your brother. Are there any other siblings? It's just the two of you. Okay.
Yeah, just the two of us.
So how much did you know about, what's next for her? So she couldn't live alone. How much were you aware of, the type of residences that she could go to? Like, did you have any idea of, like, what to do next?
I think I probably, like, thankfully, I don't know if I should say thankfully, but knew a bit more than the average caregiver, because my maternal grandmother had Alzheimer, and she lived with us for an extended period of time when I was a teenager. And as a result of my grandmother living with us, and my mom being a caregiver to my grandmother, I decided to become a professional. I'm professional. I was studying at that time, but a professional caregiver, like a PAB. So all through, like, Cégep and university, my summer job was being a PAB and a professional caregiver.
Yeah.
So, and I remember my last summers, I was working on Alzheimer's floor. So I've seen the disease. And I think that's why also between this and my grandmother, that I was so early to detect it in my mom. And so I think I knew a bit more, but it was hard for me to compute at that moment that my vibrant, super independent 70-year-old mom would end up at the end of the journey, like, not eating, not talking. I couldn't. So the phases in between, I didn't really know.
So did you know anything? Like, did you know anything about the disease, what to expect, how it was going to progress, how you should prepare yourself? Nothing.
Yeah, no.
Nothing.
For the progression, nothing. And I think to go back to your question about residence, it was also the case. Like, it became clear at some point that it was for her safety. She couldn't live alone anymore, and it was for my, like, peace of mind, and she could no longer live on her own. And I mean, there's a variety of residents that you could go to, but it's so complicated. And we were lucky enough that we could consider, like, private residence, but private or not private or whatever the price point. I mean, you need to know what you're looking for, and you have to have the knowledge, because there are different phases of the disease which require different care for, right?
Now, did you have any idea about the type of support you could receive from the public healthcare system, like how to navigate that, like what resources were out there, the role of, let's say at one point, if you ever needed to go into a public long-term care, how to access that? Did you have any idea how to do any of that?
I feel, and I'll sound like very naive to say no, because I like to think that I'm a resourceful and, like, knowledgeable person. But I thought that for me, like, the public care was for maybe later phase, or for elderlies that don't have any support. So for me, I didn't think it was available, and I didn't.
Yeah. So one thing that I found really, really daunting in my case. So, for the first 5 years that I kept going back and bringing my mother for her doctor's appointments, or, any time that I had any type of exposure to the healthcare professionals, I was never provided with any additional resources, and nobody asked me how I was doing. Like, so I I was trying to search the web, or I wasn't given any information. And I think that's one of the biggest problems and challenges with regards to caring for someone with dementia. We don't know where to go, what to do. There's not enough information, right? About
Exactly.
accessing support.
Yeah.
So what were, because I know you and your mom, but maybe what were some of the more challenging behaviors that your mother displayed? Like, how did her disease evolve?
I would say the first one at the beginning was the denial, was very challenging because she refused to get help. Um, Even in a residence, to have someone to watch her. She said, I don't need a babysitter. So
Mhm.
she was in full denial, so refusing help. So that was the beginning, and that was the challenging part of it at the beginning. After, I would say, came the depression. When she was moved to a residence, she was 71 probably, and you could
Mhm.
never tell by just looking at her. So she was amongst the young chicks, at the
Yeah,
residence,
yeah,
and
yeah.
I think she like probably realized, and she probably knew what was happening, and but she went down, and she was very depressed, and I was okay with, like, the disease, you come to accept it, but I could not deal with the depression. And they say, oh, they don't realize. I said, she realizes some things because she's crying all the time. And
Mhm.
so it came a time that I was like looking forward to her not like passing, let's say, on the other side or other
Mhm.
phase of the disease, so she would not, like, I know it would be harder for my brother and I, but it would be easier for her not to have to live with that sadness.
Mhm.
And the third most challenging, and that's was the end of her, I would say, was her aggressivity. And
Mhm.
anyone like watching and knowing my mom, she was nothing but an aggressive person, and she became verbally and then physically aggressive,
Yeah.
and aggressive with others and even aggressive with us. And it was so heartbreaking and sad to see.
So, the reality is, if for people who are on waiting lists right now to get into I mean, first of all, the COVID crisis has anybody who's on a waiting list right now to go into a public long-term
Yeah.
care facility. It's they're going to wait even longer. And prior to COVID, it was a 2 to 3 year waiting list. So people that actually need a residence, the only solution is really the private healthcare system.
Yeah. Yeah.
And what COVID has, without a doubt, uncovered is there have been many challenges in the private healthcare. Now, your mom had been to two private residences. Can you describe the experience that you had with your mom while she was in a private residence? Did you feel that she was safe? Did you feel that the staff were properly trained to care for somebody like your mom?
um Sadly, I have to answer absolutely not. um it was challenging from the beginning to the end. Even at the early stage to the later stage, where she was on a full care unit in the second private residence she went to. And at the beginning, beginning of the disease, I would get called from the private residence, and every time you see they're calling, it's like you have a call from school, and your heart stops. And they were calling me to tell me how badly my mom had behaved. And I felt exactly like a call from daycare to say, like, that my kid was like rambunctious or like
Hmm.
misbehave. And it was just, she said this, she did that. And to things like, she has been impolite to the staff. I'm like, we're dealing with someone who has dementia. Like, are you seriously calling me to tell me that? And it was always like dumping problems without never having a solution. So I'd be like in the middle of my day and going on, and then you get this call, and what I could not do anything about that. And
Hmm.
their
Hmm.
end thing was always, oh, we'll need to adjust her medication. Like, we're
Hmm.
talking about Tylenols and Advil, like her medication, it's some
Hmm.
serious medication, and it's not like, it was the approach.
Hmm.
So the approach, and then like the techniques at the second place where she was on full care unit. I mean, I had to go give her a shower. Like,
So they weren't trained to even be able to
no,
properly give a shower.
no,
So
and it's with your help. And you remember at that time we had started
yeah,
working together, that we
yeah,
brought like a
yeah,
brochure from the public health system to say,
yeah,
this is how you bathe someone, or
yeah.
shower someone who has dementia, because they kept saying, uh, she refused her care. And I was there one time when a nurse came, and she said, Madame Frigo, would you like a shower? And my mom would say, no thank you, the same way my son would have said no thank you to a shower. And then she said, refused her care and
Yeah.
left. So I'm like 2 weeks later, she refused her care. And then at some point I had to go. And imagine at some point you're wondering,
Yeah.
will I go see my kids or go to work or go shower my mom? So
Well, I remember how, one of the places that you had placed your mom was promoting memory care and that they have
oh yeah,
all the experience
yeah.
necessary. And I had to go in and train the team of staff in terms of how to shower and just how to manage and communicate with her. So so
But Claire, sorry, I'd
can,
like to mention it
yeah,
looks very negative, but I mean,
no,
I
they're,
along the way there were some wonderful people
mhm,
that have the will, but one person sadly cannot make a difference within an organization, right? So some wanted the education, some would have liked to have the training, and we're talking about like private residence where some people will spend their life saving, or some family have to like
mhm,
loans like to be able to provide this for their parents.
mhm,
And even with the means, they when there's no will,
mhm.
because remember you had like at that place in particular you had like all a program to train, and they just never responded to you.
No,
you
no.
know
And I think now, I mean, what's happened in the last few weeks when people are really seeing what, maybe the lack of training and, or what's been happening in the private residences, I just hope moving forward that they'll ensure that staff and even the employees who work there, I mean, they're entitled to be properly trained. It's
of course.
important out of
Yeah,
respect for them.
yeah,
So I want to get to now, we talked a lot about your mom, but the reality is, I mean, this is caring for somebody with dementia is a full-time job. You have your mom, you have your family, you have your life. How did the responsibility of caring for your mother impact you, your health, your family? I mean, I acknowledged earlier on, and I always do that, it took a big toll on me. I ended up suffering a nervous breakdown. I mean, how did this impact you?
oh, in many ways you have such a variety of emotions, going from like sadness at the beginning because it's like mourning your parent or loved one when they're still alive. I remember the beginning when she would miss my birthday, I would call her because that would kill me. So I would call her to tell her to call me so she would wish me
Yeah.
happy birthday. So little things like, so everything's like mourning, and then you put a cross on this and then you put a cross on that. And I had like the chance with my husband to decide to care for her full time, and having not a job, so I could dedicate more time to her and therefore to my family. But it's like everybody suffered from it. I was like, you want to do everything, and I felt I was not a good mom, not a good wife, not a good daughter, because the time I chose to take care of my kids, then I would
Mhm.
not take care of my mom. And at some point, like, a residence was on my way to school, like every day I could pass and see her in the window, and if I would have chosen to do something fun or something that I
Mhm.
have to do for my children, I would pass and I would see my mom sitting alone.
Mhm.
It would just like it kill me. So it's like you don't have energy, you have like sadness, and I felt like a Debbie Downer. And like you
Mhm.
kind of like, for me, I kind of retrieve myself from
Mhm.
like some friends and from social things,
Mhm.
because I felt like that was my only now topic of conversation.
Yeah, and most
uh,
people, unless you're going through it, it's very hard for other friends to understand,
yeah,
what you're going through. And, I kind of describe it as, it's like you're stepping into this cyclone and you get caught up in a cyclone of caregiving and it just becomes all consuming. And, even I did have a couple of close friends who would say to me, Claire, can I help? Can I pick up the kids? Can I do something for you? And I was always like, no, thanks. I'm all good. I don't need
yeah.
any help. And I don't want, and you just keep shutting yourself off and not accepting any support. Do you feel that if you would have, received the right education or the right support, you would have had a different journey with your mom, like, or
But
with yourself?
absolutely, I
Yeah.
think for me, like I know, and we like discussed about it, talked about it, your experience at the beginning,
Hmm.
and I think I reached out to you soon enough to
Hmm.
learn from, sadly, from your experience,
Hmm.
not to go down and to seek help. And seek help is means also seeking like knowledge and education.
Hmm.
So I think for me, like, I didn't go to the down 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 that I could have gone to, because also, like, you gave me great advice. My husband was supportive, like my brother
Hmm.
was
Hmm.
a big part of like the equation. But I'm thinking of like uh, caregivers that are like alone, a single parent, immigrant. Like I
Mm-hmm.
have all the resources, I have access to many things, and I suffered, and my
Mm-hmm.
family, like yours, suffered, because you come back from a
Mm-hmm.
hard day or from calls where
Mm-hmm.
your mom has
Mm-hmm.
misbehaved and hit someone with her walking stick. I'm
Mm-hmm.
not the mom, or the I was not the mom, the wife, nor the friend that
Mm-hmm.
I like to be. I mean,
Mm-hmm.
I didn't have this in me. It's hard to make the cut from going
Mm-hmm.
from this to like, whoo, like
Yeah.
your normal life and your happy self,
Yeah. I think the impact that I realized was, all along that I was going through this, and while I was as like I was starting to, the burnout was coming, what I never realized was that my children were watching me. Like I would come home, like you say, after a long day at being an advocate. I mean, all the work to be an advocate for my mother when she was in the hospital or in the rehab center or in the residence. And I'd come home and my kids were so young. And I remember my daughter saying, "Mommy, we have some homework." And I'd be like, Ask your
Yeah,
brother. I don't want to do it." Right.
yeah,
And it'd be like 4:30, quarter to 5. And I'd go to the fridge and grab that bottle of wine. And like by 6:30, the bottle would be gone. And then I just couldn't deal with anything, anyone. And then I'd, go to bed. And I just was like, it was almost as if my kids were flies. Like I kept just shooing everybody away, everybody, right?
yeah.
And then I'd wake up the next morning feeling such shame and, oh my God, I'm
Guilt.
never going
Yeah,
to do this again. And then I
yeah,
would do it again, right?
yeah.
And I think one of the lessons that I've learned, I mean, my mom passed away now 4 years ago, but what a lot of caregivers don't realize is the coping mechanisms that you start using, whether it's alcohol or drugs or cigarettes or food, don't necessarily go away just because your responsibility as a caregiver changes. And so on what I'm currently doing now with myself is I'm still healing from those coping mechanisms that I had adapted to. So, I'm no longer drinking, but it was a long process to
Right.
get there, right? Because it just became such a bad habit. So I want to ask you now, so now that you've been through this entire experience, Isabelle,
Yeah.
there's a lot of people who are going to be listening who are just beginning, who are going through it. What would be your biggest pieces of advice to people?
Oh my gosh, I could have a list. I could send
Right?
you a to-do
Like
list.
some important, like what would you
Seek
advise
help.
them?
Seek help. You cannot do this alone, and it's a long journey. Like
Yeah.
it's more of a marathon than a sprint. So with help, and help goes together, I think, with education and knowledge. So by getting like education, knowledge about the disease, how it evolves, every steps is different, and you need to react all the time. So the more you cannot be fully prepared, and it cannot. I mean, it would be utopic to think that could be a
Yeah.
smooth journey, but I don't think it has to be that hard. And lesson learned,
Mhm.
and so seek help, accept help, like you mentioned earlier. We're not nobody's like a superhuman being that
No.
could be everything to everyone. I would say, like, if you get your things organized, like power of attorney, like all the financial stuff, because you think, oh, I have time. Like for myself, like I was quite organized, but when she passed, nothing was planned. I didn't know what she wanted. I
Hmm.
like it. It
That's,
was
yeah, same
it
me.
caught
When
me.
my mom passed away, I had never spoken to her about her funeral
You know,
wishes.
yeah,
It was
me
all up to
neither.
me.
Yeah, and then it was too late, because you could still have that conversation at the beginning. I
Hmm.
knew, I have some notary friends. I'm actually a lawyer by profession, so I knew about the mandate. But some people that don't do that at the beginning, you could be like in trouble. So that are like very like logistical things, but they're important to do. And I say, if you could get rid of the guilt straight from the beginning, you would
Yeah,
like,
it serves no
yeah,
purpose, right? The
serves no
guilt,
purpose,
no
and just like
purpose.
weighs on you and takes
Yeah.
some of your energy. And it's funny to think of humor, but you need to at some point see a few of like some part of it, like with
Mm.
humor, and like the bright side of things, and learn to love that person with dementia.
Mhm.
Like, my mom was at the hospital, and we called her, when she was like aggressive, we called her Karate Kid, my brother and I, because I mean, you cannot, it's just so
Mhm.
dark that you
Mhm.
need to have a bit of a sense of humor.
Yeah, and I would also say, like, to all the caregivers listening, it's like, you really, you have to give yourself permission to have a life.
Oh yes,
We
yes, I
you
forgot about that.
have to give
Yeah,
yourself
yeah,
permission to have a life. And
yeah,
especially for the sandwich generation caregivers like ourselves, it's like your children are watching. So all the way that we're reacting or behaving, they are watching. They're just everything is sinking in. So it does have a ripple effect on the family members. My last question to you is,
Yes.
because this is a webcast with McGill University, and we're going to have a lot of medical students listening. So in your opinion, what needs to be done to improve the healthcare system regarding people who have dementia? What should be done to support families like ourselves?
Oh boy, that could be a long question, Claire. Especially at this
Yeah,
time, right? I
yeah,
would say, like, in order, and we've been told that in many other occasions, to help someone, the helper needs to be helped.
yeah.
So help the caregivers. I mean, I'm referring to an article that I read in La Presse by Agnès Gruda, and it was to start from scratch with elderly, like public health home.
Mhm.
There shouldn't have been, like, we're lucky in a way. The silver lining of the COVID is that elderlies, and most part of the elderlies are suffer from dementia and Alzheimer, and like the future number are like frightening. There shouldn't have been that many people in the public care facilities. And if there are so many person in Quebec in those facilities, is because the caregivers don't have the help, that the help is not adequate.
Mhm.
So I would say the first step to help the elderlies and help the system is to help and educate the caregivers. I mean,
100%.
everybody has to leave the office with a
Yeah.
little brochure.
Yeah, I call it, everybody should leave with a prescription of care, right? So
Yeah,
if you got
yeah,
diagnosed with any type of illness, the doctor
yeah.
would never let you leave the office without a prescription for medicine, for tests. So caregivers need to be told exactly what they need to
What to
do,
do? Yeah,
how to become educated, right? Get
exactly.
support services from the beginning, like from the moment that they, before they leave the office, they need to have information about the healthcare system, how to access support, right? Like, it's very, very important. Right?
Very important, because I'm sure that, like, if you think just of, like, and I don't want to get into politics, but just the health system, like, you treat the person with the Alzheimer or dementia disease, but if you don't treat the caregiver, I'm sure at some point, like, I've gone to the doctor crying because I thinking I was going through a depression. So there's like
Yeah.
you said, the ripple effect. So it shouldn't be like that.
Yeah. Well, I cannot thank you so much for coming on today and sharing your experience and time. And, this is really, you're paying it forward by sharing your advice. And I think it's a real, like I mentioned earlier before we started the webcast, really honoring your mom,
Yeah.
by sharing your experience. And I think we could have talked for another hour. I'm going to
Yes.
have to have
Yeah.
you on again with me, like, thank you so much, Isabelle, for being here today.
You're so welcome. And Claire, congratulations for everything that you're doing. I
Oh my
accepted
gosh.
because you were so, like, helpful to me. And if I could be helpful to anyone, like, now with social media, like, please don't hesitate to join me. And I'm sure you'll have a conclusion message, but don't stay alone, guys. Just ask help, talk about it, because you'd be surprised of how much, like, some people are living the same thing as you do. And just by talking about it and little tricks here and there, that's, at least you don't feel alone. And this in itself, I think, is important.
On our webcast, which is www.mcgill.ca/dementia, we have a whole list of resources that people could go to get additional information about the disease or during the COVID crisis, and all types of information and resources that they can go to. So next week, please join me on Wednesday, May 20th, for an interview with Dr. Serge Gauthier. He is the director of the Alzheimer's Disease and Related Disorders Research Unit of the McGill Center for Studies in Aging, and a professor in the Department of Neurology, Neurosurgery, Psychiatry, and Medicine at McGill. He will answer questions about dementia, what it is, how it differs from normal aging, and how it progresses. He will focus on what caregivers need to know about dementia and its associated behavioral and psychological symptoms to help them keep their loved ones safe and to minimize distress during the pandemic. This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. To make a contribution or for more information about our program, please visit www.mcgill.ca/dementia. If you have specific topics or questions that you would like to address during our weekly webcast, please email us at dementia@mcgill.ca. Until next week, take good care of yourselves and your loved ones. Thank you.